We're here with our friend, Dr. Tim Kaczynski. Welcome, Tim.
Hi, how are you doing today?
Good. We've received your scan of your patient, and we've segmented it, and we're ready to go review the case. It may turn out a little different from what your original RX was, the way based on how the patient presents.
Right.
So just to review the different views we have here for our audience, I'll just go quickly. What we have is on the lower right, we have a 3D rendering of the patient, so you can see the patient's prosthesis there. We can take that away, and you can see the patient's ridge, and that starts giving you an idea of where we're running into our issue is the very atrophic ridge in the premaxilla area. If we go up above, we have the axial slices, and we can scroll up and down those slices, and again, we'll talk about that as we go through it. If you look at this, you have a yellow curve that goes along the arch. The blue line cross-sects it, and that's what we're looking at here is a cross-section. And so we can scroll along that yellow arch and look at various cross-sections of the ridge. And on the lower left is a panoramic type of view. Okay, so that's just a quick review of it. So from your original RX, the plan was to place 4 implants, do a locator overdenture, and place the implants in the, I believe, in the second premolar and the canine areas.
Right.
And that may have to change slightly. Let's go through it and see what you think. So we've tentatively dropped some implants in where we could find some bone, and that may change the way we go here. So let's start on the patient's upper right in the number 3 area. So if we'll walk around the arch first and just show you what you have as far as the amount of bone to work with. So you can see in the 3 area there's some bone. Now we're just going mesial. Now we're in the number 5 area. And as we go forward, it starts getting very, very knife edge. Okay.
This was the surprise to me after reviewing the panoramic, which we would normally do looking at things in 2 dimensions. It looked like we had tons of bone to work with. And the ridge was a little deceiving also. By palpating the ridge, it appeared that we had good width of bone too. So the CT diagnosis in this case is just remarkable. It's unparalleled. I would have made a big mistake if I had gone with my original treatment plan.
Mm-hmm. Okay. So again, you can see here, which basically you have a similar situation on the right and the left. You've got bone to work with in the premolar molar area, but the anything anterior to that is very thin. Okay, and this is probably the panoramic view is as good as any. You can see you got nice clear sinuses, but you can see where the sinuses drop down. You do have an amount of bone to work with right here in the premolar molar area, and the same thing on this side. Okay, so let's just start on the we'll start on the patient's upper right and see where you would like to have your implant. We'll go ahead and blow the cross section up. Okay, so here you can obviously see this is the floor of your sinus. This is your triangle of bone you have to work with, and it looks like you've got a pretty good amount of bone to work with. Right now, the plant you had requested were Cybron implants, so what we've planned are Cybron Pro, and number 3 is a 4.8 by 9. And the question was whether you want to stay with this size. Did you have any intention of going up into the sinus?
This patient particularly has spoken about some sinus irritations in the past. So I'd prefer not to have to tent that if I can, and that's why I think a 9mm would be ideal in that situation.
Okay, and then you can see the cross section here of the tooth, and the restorative space is the yellow, so you're coming right out through the center of the tooth. As far as the relationship of the top of the implant to the crest of the bone, is that where you'd like to see it?
Right at the crest.
Okay, and it looks like you're engaging the floor of the sinus, so I think you have good stability. All right. Any other thoughts or concerns on placement for number 3?
No, that looks perfect.
Okay. So we'll just go ahead and move mesial. Okay. This is the number 5 area. Now it's a generic view based on what Cybron has provided materialized. So you can still see your diameter and your length. You just don't have as realistic a view as you had with the other diameter. Okay, so here is number 5, and the size that's in there right now is a 3.5 millimeter diameter by 13 millimeter length. So 3.5 by 13. It looks like you do have a nice amount of bone to work with.
And the most important thing here is that we try to keep those implants parallel to each other as much as possible.
Okay. And then, yeah, the other thing that we can talk about once we figure out where you want to have place your implants is how you would like to restore them. We splint them with bars, or if you really want to go freestanding, so we can have that discussion too. As far as placement of this implant, any changes you'd like to see on that?
No, that looks good too, right at the crest of the ridge. Nice long 13 millimeter implant is ideal.
The other thing that I think of is maybe bring this up a little bit this way. Okay. Now you do have the gray is 1.5 millimeters, so you do have a good 1.5 millimeters of bone on the buckle. A little thinner on the paddle. You okay with this position?
Yeah, I'm fine with that. Yep.
Okay. So we'll go ahead and go out of that view. Okay, now if we keep going mesial, then you can see where things fall off. I'm not sure if you'd be able to get anything any further mesial